So here we have an entirely new playlist that is dedicated actually to the openings of the skull. And in addition to the openings of the skull, we're going to consider cranial nerves that go through those openings and other things like the middle meningeal artery and the carotid artery, the internal carotid that comes up through all of this system. So we're looking at the openings of the skull and we're considering what could go through them. Here I've actually shown you a part of our lab practical in which I am, in essence, I'm tagging, so to speak. Maybe you'll want to print out this particular handout I have for you, and you'll apply cranial nerves and the names of openings here. And then here we have the actual listings of the names of the openings. So down this particular handout on this side, I'm listing names of openings. So we have the cribriform foramina, the optic canal, the superior orbital fissure, the foramen rotundum, spinosum, carotid canal, etc. And I'm presenting to you in clear order here the cranial nerves 1, 2, 3, 4, 5, 6, 7, 8, all through 12. There are 12 pairs of cranial nerves, and that they reside in life in these openings. And so particular ones reside in particular openings. And I briefly mention function, not in a broad way, but in just the most simple terms of what's going on with these different cranial nerves. If you need to get a better view of cranial nerves, but we're going to have it, of course, but I'm sort of tricking you into learning nomenclature. Eventually, in Chapter 13, we're going to learn all the cranial nerves. Okay, isn't that exciting? So that's part of the deal. We'll take them one at a time and we'll go through each one of them. But in the meantime, we're going to just focus here on this particular handout. And I'm sending this one to you as an email attachment. And you're going to be able to, how shall I say, have your way with it and play with it at your leisure. So here we have cranial nerve number 1. And who is that cranial nerve? It turns out this cranial nerve number 1 is the olfactory nerve. It's going through the cribriform plate of the ethmoid, which looks like this. This is the ethmoid bone, a central bone that sort of is in the middle of the nasal cavity. Remember that it has a septum, and the septum, the perpendicular plate, actually pushes up right here, and this is called the crista galli. And then there's a flat portion right here called the cribriform plate. It's at the very top of the nasal cavity and has little tiny openings so that we can have our receptors in the nasal cavity feed upward, and then there's a big bulb right here which represents cranial nerve number 1 for smell, the olfactory nerve. Okay, then, and that's represented here. If you want to take a moment and actually label then this particular stirring rod, these are DNA stirring rods. I just decided since we have so many that I would use them for this purpose as well. You can label that little stirring rod the cribriform foramina, cranial nerve number 1. Then we move on to cranial nerve number 2. That's this one right here. And you can label this one cranial nerve number 2. And here is the optic canal opening here. Okay. Now, normally we have three-dimensional skulls available at your table. I'm so sorry that I can't do that for you at this particular time because it makes it so much more, how shall I say, eventful and stimulatory. At any rate, we do have here the optic canal. And the optic canal is going to house in life the optic nerve. The optic nerve, as you're well aware, is for the purpose of vision. It's the innervation for the retina. Okay, let's come over here for a moment and see where we are with regard to this. The cribriform foramina, cranial nerve 1, olfactory nerve, and we're involved with smell. Okay, then the optic canal, Cranial nerve number 2, the optic nerve, vision. Okay, now we have a complex situation where we have the superior orbital fissure. Okay, you can see that by looking in the front of the skull through the orbit, and you'll see a big orbital fissure, a fissure in the way back. But here we're actually going to see it from the back side, and we're going to see cranial nerve 3, cranial nerve 4, cranial nerve 5, part 1, cranial nerve 6. Okay, so let's take a look at that. And here we are now. It's going right underneath this lesser wing of the sphenoid. Okay, the lesser wing of the sphenoid. And if we want to see that, that's this yellow stirring rod right here is actually penetrating through and under. So we have the superior orbital fissure. You want to make a note of that, and then you want to look over at this table over here and see what's in the superior orbital fissure. Okay, so, and it's a busy place because it's serving the eye. It's a way into the orbit of the eye. So let's see what all of the contents are. In the superior orbital fissure, we have cranial nerve 3. It turns out that the oculomotor nerve here is operating some muscles, movement of the eye. It's also operating the size of the pupil. Okay, so we have an autonomic function there, and in this case it's going to be parasympathetic, so it's going to be constriction of the pupil. Okay, oculomotor nerve. And then number 4 is called trochlear nerve, and it also operates an eye muscle, one eye muscle. It makes your eye look down and out. It's an extraocular eye muscle. Okay, and then when it's contracted, the eye sort of travels downward and to the right, or downward and to the left. So down and out, we call that. Okay, and then cranial nerve let's go on to 6 first. It's easier. Excuse me. Cranial nerve number 6, abducens. It's so named because it's going to abduct the eye laterally. So we are humans who basically we're sort of later iterations. We're not the beta model. I would say that there's earlier versions of us that left the forest and joined another team, which is the grassland, and we scan horizons. So the abducens nerve abducts the eye, and it abducts it for lateral tracking. Okay, cranial nerve number 5, trigeminal. Trigeminal is exactly what it says. It's a triplet. Gemini means twin, and in this case it's trigeminal. So we have 3 divisions. Division 1 here is referred to as ophthalmic, and it innervates the eye for pain, also temperature, and then goes on and does the upper lid and the forehead, and it's traveling through the superior orbital notch, or foramen, at the very top of the orbit of the eye. So as you place your thumb, for instance, up against the upper orbit of your eye and press into the orbital bone, you can find a little ridge if you happen to be the person who has a notch, or you can certainly find some tension relief by pressing up there because you're relaxing this particular nerve. Okay, so we'll pick it up now in the next section, part 2.